From Via Benefits by WTW, welcome to Ion 65, a podcast for employers and plan sponsors looking to elevate their retiree healthcare benefits.
Today, I'm speaking with Susan Morey about her experiences in selecting drug coverage, choosing a medical plan, and the overall enrollment process into both drug and medical plans. I spoke with Susan a couple years ago, and I'm excited to check back in with her. Hi, Susan. It's so great to have you here. Let's jump right in. Can you tell our listeners how long you've been retired?
I've been retired since June of 2016. My former employer was doing restructuring and some of us were terminated. But because I had enough time with my former employee, I did qualify for retiree benefits. So it was quite sudden, and your immediate panic is, oh my goodness, what am I going to do for health care? And so I almost immediately contacted Via Benefits, and they were extremely helpful to me. Very, very caring, gave me a lot of information because I thought, oh, now I have to sit down and I have to compare all of these plans and decide which one is going to meet my needs, which one is going to cover my drugs and my medical conditions. And lo and behold, I didn't have to do any of that. I answered a few questions and I gave them the list of my current medications. And while on the call, the agent helping me came back and made some suggestions. And I reviewed the options and made a decision.
One of the things that you had mentioned at that time was that there was an unexpected layoff, and you'd been with your former employer for 35 years. And due to your length of service, you qualified for their retiree medical plan that included an HRA. Can you tell us a little bit about any kind of trepidation or concerns that you had at that time for your health coverage?
I was laid off, and I was at a point in life where I could qualify for Medicare, but I knew that there obviously were supplemental plans out there. And my first reaction, along with a few other people who also were laid off, was, what do we do next? And then we received our severance packages with information about Via Benefits. And I contacted them immediately because I couldn't afford to be without health care even for a few days. And the health care that I had with the company was going to expire within 10 days. So I called Via Benefits, and I just remember a sense of relief that the person I spoke to understood my situation and assured me that you folks could help me, and took all of my information. The original interview was extensive and asked for my prescriptions, which I was able to provide. I had gone to the website and put in the medications that I was on. I was given an option of a few health plans as well as supplemental drug plans. And based on my own personal needs, I chose the plan that I chose. And I'm still with them. I've been using the same plan since then, and I haven't found anything any better. But the plan I have, I've never seen an invoice. I've never seen a bill. So other than paying my monthly premiums, most of which are covered by my health savings plan through Via Benefit, I'm quite happy.
You beat me to the punch with one of the things that you brought up in terms of being able to select a new plan or stay with the same plan year over year. So you take advantage of the coverage checkup tool every year. Do you do that online, or do you do that through a phone call with one of our advisors?
I do it online. And this year, for some reason, the plan that I have been on did not come up in the list of results when I was online. And I got a little concerned because I thought maybe it's no longer in the field of plans to choose from. So I did have to contact you, and I was assured it's there. In fact, I took the same plan, little tiny bit different where I have a deductible, but the cost in monthly premiums far outweighed the amount of the deductible. So I'm still with that company. And as I said, I haven't seen a medical bill. So all is good.
And Susan, you mentioned earlier when we first got on the phone some significant medical challenges in the past year or so. And it sounds like, if I'm hearing you correctly, that you wouldn't have changed the plan even knowing what you know now, looking back.
Oh, correct. No, I would have had no need to. I didn't even think about it because I had had good coverage all along. And I'd had some different medical things over the years, but nothing as significant as what happened to me in 2022. And I didn't even think twice. I thought, they've covered me and they've never denied a claim. Some of the testing has to be pre-approved, the more expensive scans and things, but there's never, ever been an issue. And knock on wood, I hope it stays that way.
That's fabulous. And what about your drug coverage? I think that you did mention when you review every year that you have made some changes to your drug plan. Do you continue to change that? Has that met your needs?
This year, I did not have to change it. It came up as being the most economical for the drugs that I'm on. And so I just stayed with it. I didn't even, I said, okay, there, it's in the list. And I think the premium actually went down a little bit this year. And a couple of the drugs prices might have gone down. I happen to be in the donut hole at the moment. So I'm paying 25% of retail, but that happens to everybody. If your drug expenses exceed a certain amount, you're going to end, and you're on Medicare, you end up in the donut hole. And I don't think I'll come out this year, but I might. And then my drugs will be basically free.
When you're selecting your medical plan, what would you say is the most important factor in selecting the plan?
One thing, I wanted no co-payments. I did not want to have a copay. I didn't want a plan that required referrals or different. I mean, I understand there's referrals for things like CAT scans and things, but for other illnesses, I didn't want to have to get a referral. And I didn't want to see a bill. And I could have chosen a less expensive plan, without a doubt. I definitely could have. But I felt that given my health history and the fact that I had been with this company for many years, I was with them before I retired. And I said, you know what? I'm going to stay right where I am. I'm not going anywhere.
And now your employer also provides you with dollars through the form of a health reimbursement arrangement, an HRA,
yes,
as well, to offset expenses as well. So does that cover the cost of the premium or portion of that?
Most of it. My premium is covered for probably 7 months of the year based on that money, the reimbursement. And that's obviously been wonderful.
That's a significant savings throughout the course of a year.
Yes.
But let's go back maybe further to when you first learned about VIA benefits and how it was communicated to you, or what was communicated to you. Is there anything that you would change in that regard that would be helpful?
As far as VIA benefits, it was very clear what you would be able to do for us. And in fact, I have a friend who's going to be retiring in the not too distant future, and she reached out and said, how did it all go? Because she's also concerned, and she wasn't aware of VIA benefits. Of course, she hasn't retired yet, so unless you're retired, it's also a benefit that was grandfathered in. So you had to have been employed by the company prior to, I don't remember what the year was, and you had to have a certain number of years of service to earn this benefit.
And she will be eligible for that?
Yes, she definitely will be, yes. Yeah.
And is this for all retirees or only Medicare eligible retirees? Do your pre-65 retirees stay on the company's group plan, or do they also
go to Via Benefits?
I have one friend who I'm in contact with occasionally, and she is pre-Medicare and she's on a group plan. I think this is only offered to those to the Medicare eligible employees, but I could be wrong. I just don't know. And the company I've been out of there since 2016. The company has been restructured and changed considerably since then. In fact, it's like we all expect someday to get a letter saying that the benefit has disappeared. Well, hopefully not, but
yeah, how would that make you feel? not great.
No, I would not be. We would not be happy at all. It's not a huge amount of money, but it's a helpful amount of money.
A, the money, and B, having someone there to help you in selecting the plans.
Absolutely. That the money was great, but the fact that I didn't have to do anything except pick up the phone, give a little bit of information, and somebody else came back and said, here's your options. And I was on the website. It was very clear. And the way you have your website set up, you can compare. You choose a few plans, and you click the little box that says compare, and then another screen comes up, and the plans you chose are displayed so you can compare them side by side to see which one offers what. And I just found it very, very user-friendly.
So I'm going to ask you a question that I know is purely going to be your opinion, but I would like to go back to the question around pre-Medicare. And a retiree who is retiring, let's say they're 62, and having the choice between staying on the employer's group plan versus having access to the same marketplace, different plans because they're not Medicare plans, but still having choice and having the benefit advisor. Do you think that a retiree would prefer the simplicity of just being told, here's your plan, without having to think about it at all, versus the choice in plans on a marketplace like Via Benefits?
Well, I know from when I was employed, every October when open enrollment rolled around, there was a tremendous groan throughout the whole company because we're given so much information, and it was so confusing about what plan to choose. Drove us nuts. And even though they had seminars and people to ask questions of, it was very confusing. So if there was a Via Benefits for people who are pre-Medicare, I would definitely have taken advantage of it, because what I had to do to get Via Benefits to give me options was so much easier than reading all of this material that the company put out and all of the options and the hypothetical, you have one child or you don't have any children. And, oh my, drove us nuts. So,
let me ask you another hypothetical question, whether it's pre-Medicare or Medicare, but with Via Benefits. However, the hypothetical is your employer does not provide those HRA dollars. Would a service like Via Benefits still be beneficial and something that would be useful to a retiree?
Yes, most definitely. Most definitely.
Why do you say that?
Because it's one-stop shopping. It's not going to Blue Cross's website or Harvard Pilgrim's website and, jotting down numbers and trying to see, okay, how much is it going to cost me for an emergency visit versus, just an office visit. I would have definitely used something like Via Benefits prior, even while I was employed.
Are there any questions that I haven't asked you that you think would be useful for an employer to know, or advice that you might give an employer who is evaluating Via Benefits for its retirees?
I would say that my experience has been 100% positive. I would encourage an employer to use Via Benefits because the people that I know that have retired who are using you, no one has any issues that I'm aware of. We go online, we fill out all the questions, and, is there something different? I I would be very reluctant to change plans, even if VIA Benefits suggested a plan that might not be as expensive, only because the coverage that I've received and the medical issues that I have. I'm just going to sit tight where I am, and I'm a little conservative, so.
That makes a lot of sense. Well, and that's helpful to be able to have that choice that you can make for yourself.
Yes, that's the big thing, that it's truly my choice what I want to do. And VIA Benefits is not pushing me towards one plan or another, totally impartial. They gave me the facts, and then it was up to me to make my decision.
Well, Susan, I'm really grateful to be able to connect with you again today. I wish you continued health in the future, and I look forward to being able to potentially do this again with you in the future another day.
You've been listening to Eye on 65, a podcast by WTW. For more information on VIA Benefits and the solutions we provide, visit OptimizeRetireeBenefits.com. That's OptimizeRetireeBenefits.com.